Today we're going to talk about the increase in COVID-19 and also back to school. And our guest today is Ahmed Abdille, and the expert of this field. And Ahmed, welcome to the show.
Thank you, Mohammed. Thanks for having me. And thank you to Salaxley TV for organizing this discussion.
And thank you. Just give the people who's watching us a little bit your background. You are the executive director of the Somali Health Board. And can you give us a little bit more information?
Yes, my name is Dr. Ahmed Ali. I am the executive director for Somali Health Board, which is a nonprofit organization based in King County that works to address health disparities within immigrant refugee communities throughout King County. And we've worked tirelessly throughout the last 3 years in working with King County Public Health in ensuring that communities are vaccinated and protected.
Wonderful. And the news nowadays, there's increase of COVID-19. And can you tell us is that included King County?
Yes, we've seen an increase or spike in terms of COVID-19 cases since August. And typically this is common now that most people are coming back from vacations and summertime. And there is a perception between all of us that the pandemic is behind us. So people are going out there not masked and big crowds. So there has been an increase, and there's a new variant that is also increasing the number of rates that we're currently seeing in King County, which is similar to what we're seeing across the country.
So this number increase is not the summer, just the beginning of.
Right after people are coming back from vacations and lots of travel, and the new variant. There's two variants that actually now are very common that we're seeing at this point.
Okay, are you recommending the people to additional protecting from COVID?
So the recommendations that public health and health professionals have been recommending since the pandemic is something that I would highly recommend everyone to follow up with. And that includes making sure that you're up to date with your vaccines. If you have not got the bivalent booster, go ahead and do that. When the new variant dose comes up in late fall, sometime in October, make sure you're also vaccinated as well. I will also highly recommend that people start masking if possible, especially if you're going to be in places that has a lot of people, large crowds of people. Just make sure that you have your N95, KN95 with you. And then, the usual things are just making sure that you wash your hands and things along those lines. Yes.
Wonderful. And it's back to school time. And are you concerned the increase happen also in the school time?
The good news is that the kids have higher or less likely to be severely ill from COVID-19. And also we also have seen a lot of vaccination within our kids as well. Across the county, but considering that there will be large number of children in one place in multiple schools with lots of friends mingling and so forth, it is still recommended to follow the same recommendations. Make sure your child is vaccinated. Make sure that you are also testing should anyone come down with the typical symptoms that we know of COVID. That includes runny nose, sore throat, headache. Fever, anything that comes along with that, or if they tell you some of their friends tested positive, then I'll also recommend that have the test kits at home. Just make sure that now everyone has access to those things, and it's easier for you just to test it at home to rule out anything. And one other thing, Mohammed, I would highly recommend folks is as I'm taking advantage of this opportunity is. Also get your flu shot throughout this time of the year. Okay. It's also important that as you get your COVID booster, talk to your providers to make sure that you're also getting a flu shot as well.
What kind of vaccine you recommending for the kids and the adult? I mean, are there different kind of vaccine they can get?
So the dosages are different, but we still have Pfizer, Moderna, and other options as well. And it depends on the age. It depends on whether they've received the doses in the past. Right now, we're only giving kids bivalent. But when the new variant comes out, that will be monovalent, and that will be just one shot. It looks like things are going to be that way. Once a year, people will be getting COVID vaccines because of the changing and mutations of the virus.
Okay, so Somali Health Board, you are head of and had successful vaccination last time. And can you give us the number you guys vaccinated in the community?
Absolutely, yes. Somali Health Board worked very closely with King County Public Health, and we had close to 300 COVID testing sites in the last, since the vaccination started. That has actually translated to almost 30,000 people that we actually vaccinated throughout King County. And these numbers are some of the biggest accomplishments we've had as an organization, because we know some of the community members who would only go to vaccinate only to people where they can relate to, that they can look up to, they understand their language, their culture, and also as some of our staff who are healthcare professionals that are people of color. We vaccinated almost every single school in Southeast Seattle and Central School District within Seattle School District. We vaccinated almost every single church, mosque in South King County, and a lot of the community centers as well that also worked with many of our community-led organizations to make sure that those vaccines are accessible. So King County Public Health really worked closely with us because of the connections and networks we have within the community.
Up to 30,000, that's a lot.
Yes, it was.
That was very successful.
I clearly remember that in several occasions during the height of the vaccination, we had almost 600 Uber and taxi drivers, and almost every other day. And we had clinics that are ongoing consistently, probably 50, 60 clinics in a month. Sometimes we would have 3-4 clinics in which we would make sure that we have enough vaccines for our community and enough volunteers and staff that we're able to do that.
All right, we almost at the end of the show. What do you recommend people to do at this time?
My recommendation is make sure you get your vaccine up to date, particularly COVID. Get the flu shot if you can, and I highly recommend that, especially now. There's of course, get yourself tested should you have any symptoms, and maintain the masking and social distancing should you become positive or suspect that's the case.
Wonderful. Thank you very much. Thanks for your time. And you said test is the most important one.
Absolutely.
Check up to date your vaccine.
Yep.
And wear
mask.
face mask.
Yes, absolutely.
Recommended. All right. Thank you very much. Thanks all of you for watching the show. Thanks to Ahmed Abdille.